Okay, good afternoon, colleagues, speakers, participants to this afternoon's webinar. I am very happy to welcome all of you to today's webinar on lead poisoning as a global environmental justice and human rights issue. My name is Professor Yvonne Lowe. I will be your host, and I implore all of you to remain attentive, and so we can have a very insightful discussions and not only end with information, but also empowered to act. Indeed, lead poisoning remains one of the most widespread environmental health challenges globally, disproportionately affecting children and vulnerable communities, particularly in low and middle income countries. Beyond being a public health issue, it raises critical concerns about environmental justice and human rights, as the burden often falls on communities with the least protection and resources. Today's discussion would explore, one, the broader framing of lead poisoning as a justice issue, and also look at the systems that allow exposure to persist. The discussion would also look at the environmental processes that influence its long-term impacts. We are privileged to have a distinguished panel of speakers who will guide us through these perspectives. Before we begin, Nana, are you there? Would invite your regional program director. Do you introduce him of Africa as Pure Earth to deliver the opening remarks? Reverend Dr. Kwanzaa.
Okay. Before Dr. Kwanzaa comes in, I would love the speakers to introduce themselves so that the audience also know about their speakers, and Dr. Kwanzaa comes in to give the opening remarks to commence that. Thank you very much.
Okay, thank you. So the speakers, we shall invite our first speaker, Mr. Hobson, to introduce himself.
Thank you very much, Prof, for the opportunity. My name is Hobson Ejapon, a Principal Program Officer with the Environmental Protection Authority, specifically with the Intersectorial and Sustainability Network Department. So I'll be doing a presentation. So I would like to extend my greetings to all on this platform, and we expect to share knowledge, with each other. And that is my expectation. Thank you very much.
Thank you, Mr. Hobson. And I'll call on Dr. Puti, the second speaker, to introduce himself.
Thank you, Prof, and thank you, the larger Pure Earth family and the Nevada School of Public Health, the organizers of this event, for the opportunity to be able to share some of my thoughts on some of the key factors that made childhood lead poisoning to persist. As I was introduced, my name is Dr. Kuti, a public health physician with over 20 years of managing public health interventions in various African countries. But currently, I run a social enterprise, Afia Lafia Innovations, that focuses on scaling known intervention to be able to address known public health issues for Africa. And our current focus is on childhood lead poisoning. And that's why it really gladdens my heart to have this opportunity to be able to be part of this one esteemed panel and esteemed team this afternoon. Thank you so much.
Thank you so much, Dr. Kuti. Dr. Marian Sapa, please do us the honors.
Thank you, Prof. I'm Dr. Marian Salom Sapa, a senior lecturer and research scientist at the Department of Earth Science at the University of Ghana. I'm a geochemist and a cosmochemist, but my research interests that are relevant to this context for which we are here today has to do with environmental geochemistry and environmental geoscience. And so today my talk is going to be centered on the geochemical legacies, the fundamentals of the geochemistry of lead that is making it an issue for our attention this afternoon. All right. Thank you very much.
Thank you so much, our distinguished speakers, for introducing yourselves. And we look forward to very insightful discussions this afternoon. Nana, so if...
All right, thank you very much, Prof.
Okay.
So at this juncture, I want to step in for you, then I go back to my hiding space. Ladies and gentlemen, I want to take this opportunity to introduce the Regional Program Director of Pure Ed, the Regional Program Director of Africa, Reverend Dr. Ismond Kwanzaa. He's going to give us the opening remarks and pave the way for this discussion to commence. Please allow me to introduce my boss, currently the Regional Program Director and also the Country Director for Ghana, Mr. Ismond Wisdom Kwanzaa. Sir.
Thank you very much, Nana, and good afternoon, good morning to wherever our distinguished attendees are joining from. I want to start by acknowledging the distinguished panelists who would be doing justice to this subject today. We are also happy to be collaborating with University of Nevada, Las Vegas School of Public Health on this webinar series. Lead poisoning as a global environmental justice and human rights issue cannot be underestimated at this time. Lead is the single most damaging chemical to human health, with an estimated 1 billion children affected by lead poisoning globally as we speak, according to Institute for Health Metrics and Evaluation study, which is yet to be published. The impact of lead exposure is devastating and irreversible, stunting cognitive development, reducing educational attainment, and limiting future earnings. Lead also contributes to poor maternal and newborn outcomes and raises the risk of cardiovascular diseases and premature death, cutting short 3.5 million lives each year. According to estimates, this is more than malaria, tuberculosis, and HIV combined. Mm-hmm. This takes a social toll on families, communities, and government at large, and add up to a global cost of $6 trillion annually, nearly 7% of global GDP, according to World Bank Lancet publication in 2023. Today, approximately half of all children in low and middle income countries have concentration of lead in their blood exceeding the WHO threshold for clinical interventions, though there are no levels there are no safe levels once you have lead in your blood. Even the smallest amount of lead can cause irreparable damage. Children are exposed through everyday products such as paints, makeup, the eyeliners, food and cooking tools, to which lead is added for its malleability, durability, and color. Lead also enters the environment through harmful industrial practices, such as the improper car battery recycling, which contaminates soil, air, and water. Yet the global crisis is one we know how to solve. It's solvable. High-income countries like the US, Canada, have been able to cut children's blood lead levels dramatically. The US, for example, saw a 75% decline in the first 8 years of coordinated actions. Remarkable declines have been driven over time by increased data on the prevalence of lead and its sources, better regulation, and increased public health surveillance. But in most low middle-income countries, the lead crisis remains invisible and unaddressed due to lack of nationally generated data and capacity to design and implement actionable country-specific plans. Pure Earth and the partners are working to translate the progress against lead poisoning made by high-income countries to low and middle-income countries. Over the years, we have launched our integrated national approach, working hand in hand with governments, global agencies, and local civil society organizations to make real progress against lead poisoning by uncovering the true scale and sources of exposure, developing national mitigation plans, and designing strategies to address the most critical exposure sources. This comprehensive approach builds on Pure Earth's 25 years of experience, completing 81 lead exposure reduction projects across more than 50 countries. We now have a critical window to mobilize scale action and deliver solutions where they are needed most. Global momentum has accelerated in the past 5 years, marked by 2021 completion of a global ban on lead in gasoline and a 2024 launch of the Partnership for Lead-Free Future, with over 30 countries signing on to support efforts to end childhood lead poisoning. But the path ahead is complex, as the remaining sources of exposure are diffuse and often hidden in daily lives. This webinar presents us the opportunity to discuss the human rights element of this lead poisoning situation that is impacting communities and affecting children and pregnant women in particular. I would like to call on all of us gathered here this hour to commit to brainstorming and understanding ways that we can continue partnering with governments to raise awareness, to identify specific sources, to design mitigation strategies to address lead pollution and its impacts. Thank you very much, and I look forward to the interesting discussions. Thank you.
Thank you so much, Reverend Dr. Kwanzaa, for setting the stage so powerfully for today's discussions. Indeed, we look forward to very insightful discussions. It is now my pleasure to invite Mr. Hobson, our first speaker. He will be speaking on reframing lead poisoning as an environmental justice and human rights issue, rather than only a technical health problem. Mr. Hobson, please kindly note that you have 10 minutes to do this presentation. You have the floor.
Sorry for that.
Thank you very much, Prof, for the opportunity. I think per the topic, how do we then end lead poisoning through environmental justice, a global call to protect public health and human rights. First of all, I would like to thank Pure Earth and its partners for this exercise. We have been working with them over the years, trying to find a solution to this menace that we are confronted with. And as it has already been indicated, it's becoming alarming, and it's becoming a global, it has actually become a global concern, which means we need at all costs find a solution. So I'll be taking it from the environmental protection perspective, and I'll be delivering on our mandate as Environmental Protection Authority, the responsibility that we have towards the people, as mandated even in the Constitution, and also the law that we have to work with. So if you can move forward. So lead poisoning remains a major environmental and public health threat. And I think it has already been mentioned, the effect on vulnerable population. And in this case, we are talking about children and women. Women and children are involved, then it means we need to be very swift in providing a solution, because our women, they build up a nation in terms of even our population, even though we participate, but then women always take care of us in every aspect of our life. And children, of course, is the future that we are building. And at the end of the day, whatever that we are doing is for them. And if their future is not guaranteed, then I don't think we have to even go ahead to prepare for what we are thinking. Because the same people that we are planning, that we are trying to make sure we make their lives better, is being affected by lead poisoning or exposure, then it's something that we really need to look at. It is very alarming per the statistics. If you take 3 children, one of them is in one way or the other is exposed or affected. And that is something that we need to look at. And now we are in a global world, and low middle income countries, we are also part and participating. And therefore, if you have 1 out of 2 being affected or exposed or having blood lead levels so high above the permissible levels, then it means we need to do something about it. Environmental justice demands protection of all communities. And I would say that some, in this case, the children, women that are involved, those who are vulnerable to our environmental externalities, so to speak, are innocent. I always say that you can't do your business and then expect that somebody should be affected adversely out of what you are enjoying from. And in this case, if something like that happens, then this is subject to environmental injustice and must be addressed at all costs. Government have a responsibility towards us, and it is mandated by our constitution, even the 1992 constitution. It is clear that there is a responsibility towards the people, and we must ensure that as government, we do what is expected of us, hence the institutions that we have to ensure we undertake our mandate to protect the people that is expected to, to take care of. Can we move forward, please? So understanding lead poisoning. Of course, we all know the toxic substances that we have around us, being from lead acid batteries, recycling. And this is very unfortunate. We ask ourselves those times that we used to have agugloshi, and I know they've come back again. We demolished the sites at a point, and then they scattered. You ask yourself, where were they actually recycled? Where were they, business? Because the business was still our recycling lead battery in our communities. And in most cases, ask even those who buy these materials, and they tell you that we don't buy the batteries in whole, but then we want it dismantled. And those scavengers who are involved in these activities, you ask yourself, what skills do they have? What facilities are available for them to undertake this exercise? And we normally find these activities happening within communities. Paint, contaminated soil and dust, electronic waste, mining and industrial emissions, all this, contribute to the exposure. And then somebody will say, oh, the activity is somewhere not even close to me, but through inhalation, through injections, because somebody is planting where maybe the person don't have an idea. In Accra, you can see a lot of people doing vegetables along our buffer areas. And then you ask yourself, do they actually even know the composition of the soil where these activities are being undertaken? And they eventually will contaminate our food. And these are some of the mediums through which we can also accumulate this lead, into our bodies. And then eventually when the body cannot take it anymore, all the effect, begins to show up. Can we move forward, please? We all know severe neurological damage in children, reduced IQ levels that is happening, learning disabilities, and we know we are in the communities. And then being from, professor and then doc from the academia, some of these things, I know you have observed it. And some of, as we also know from our communities, what is happening. Behavioral disorders, kidney and cardiovascular diseases in adults. Now the cases are increasing almost every day. And then you ask yourself, where are these things coming from? Those times we were not experiencing some of this, but now it is increasing at a faster rate, which means that something needs to be done at all costs. Increased risk during pregnancy, long-term economic and social consequences. And these are what we are impacted with when it comes to lead poisoning, which Ghana is not exempted. Environmental justice ensures fair treatment and protection for all people. And then the question that I'll ask is, are we really protecting the people? We need to answer it ourselves. And it means that there is a lot more that we need to do. Poor and marginalized communities often face higher exposure. And then we did some survey at Afienya area, and we see the communities around, and you check their background, and you can see that definitely the poor ones will definitely settle around those areas. and they are the ones that will be affected. And you know the diseases that is, the effects of high blood lead levels, can have on human body. And even if you want to do something in terms of treatment, you know how much it costs to treat, and you ask such people, how can they also have such treatment? And it means there is some injustices somewhere that need to be looked at. Informal recycling, unsafe industrial practices, increased risks. Now everybody is doing anything anywhere, especially when it comes to the electronic waste. Even though there is a ban on open burning, but then you can see smoke in most cases around our communities. And these are the mediums through which emissions can happen. And then cumulatively, it can then affect the human body and then begins to have its own effect on the body. Ending lead poisoning is both a public health and human rights issue. Please go ahead. It means we need to do something about it because the Constitution of Ghana, we have our own fundamental human rights, and that must be observed. Article 36, and I state that state must safeguard the health and welfare of citizens. And therefore, states, we are all involved. It means that government needs to also put things in place to ensure that the environment is protected to safeguard the people or the citizens. But then we ask ourselves, are we doing it as a regulator, as civil society? Where have we got into? And I think the conversation begins from today. The solution starts from today. And I know we are doing some surveillance, we are doing some remediation. Pure Earth supported us in Bremen to do some remediations among others. And I think we need to intensify it. Currently, we have done, we've established what we call the lead technical working group through this project. And I think we still need to do more to ensure that we safeguard the people of Ghana and even other neighboring countries as well. Article 41K, citizens have a duty to protect the environment. And it doesn't rest with only government, but then individuals as stewards of the environment. We need to ensure that we become each brother's keeper and not to behave like not in my backyard, but then whatever that we see around, whatever menace that we in our opinion, we believe can have a negative impact on us, need to be collectively addressed. Environmental protection is therefore both a state responsibility and civic duty as well. And in this case, that is why we are working closely with the civil society organizations to ensure that we tackle lead menace in the country. Because a lot of surveillance needs to be done, and we cannot do it as EPA alone. Therefore, we need other partners, including the academia, to support us in doing that. Right of children and women. Children have the right to survival, development, and protection. And this is a fundamental human right. And it means we have the mandate in the Constitution to do what is expected of us. Women have the right to health and safe living conditions. And as women are classified as vulnerable, we need to make sure their interests, their health is also protected at every point in time. Exposure to lead violates these rights. Like I indicated earlier, if they are exposed to these harmful substances, then it means there is some environmental injustices somewhere because they have the right to live in a very safe environment. And therefore, whoever is responsible, be it a regulator, be it even the generator of that lead poisoning, must also take certain systems or certain control systems to ensure that people are not adversely affected by their activity. I always say that you can't do your business and somebody says somewhere, and then he or she is negatively affected by your business. You need to make sure you are subjected to the conditions under which these operations can happen within our communities. And we need to also ensure that assessment is properly done to be able to identify some of this impact and then mitigate it accordingly by way safeguarding the people living around such facilities. Environmental policies must prioritize protection of children and pregnant women. And I think I've already indicated that those who are vulnerable need to be looked at. Things that will have impact on vulnerable people need to be addressed at all costs. And it's not something that is of luxury, but it's something that is within their rights, and they must get it from the public institutions and also the civil society among those who play or actors within the space. Can we move on, please? The role of Ghana's legal and institutional framework. Environmental Protection Authority regulates environmental pollution, and that is our mandate, even though there are some challenges that we have, and currently I know is being addressed. Initially has got to do with our strength, and now our capacity is being built by Pure Earth. As I speak to you, we are currently at the Palms Hotel, trying to build our capacity to be able to use the SRF to do initial baseline studies and also do a lot of surveillance around to be able to know where these issues are and then find a solution to them as well. Environmental laws support monitoring and enforcement. And this is what currently, I don't know whether you have observed the landscape. We used to have the Environmental Protection Agency Act 490, and now we have the Environmental Protection Act 1124 and its related, regulations, which means that we have been given the mandate to coordinate. And one key aspect that the environmental protection in terms of mandates that has been added is the coordination mandate to ensure that we have an oversight responsibility over the environment and then climate change related activities, which means that we cannot continue to say that it's not within our mandate, but rather ensure that we put the systems in place to prosecute those who are engaged in activities that is not sanctioned by law, and they should be punished accordingly, and then build our capacity as an institution to work closely with other relevant institutions to ensure that we protect the environment of the Republic of Ghana. Global call to end lead poisoning. We need a safe management of used lead acid battery recycling. And I think the World Bank supported us, to tackle the electronic waste, which we are currently building facilities in Tamale. In Accra, we are done with it in Greater Accra region. We are also doing one in the Eastern region. And then we want to spread, but then going down to the community base and establish facilities that will be able to handle electronic waste in Ghana. And use lead batteries, what we call the LULAB recycling, is happening around, which we need to tackle and then make sure facilities are provided for safe and sound environmentally, recycling in Ghana. Then public awareness and community education. And I think one of the key aspects of what Pure Earth and EPA collaboration is about is to also ensure that whatever data that is collected is communicated among institutions that need that data. And then we all come together and find a solution that will stand the test of time. Monitoring and surveillance systems is what we are building our capacity on to ensure that at least at every level, EPA, we have received one SRF machine from Pure Earth, and we would like to thank them so much for that opportunity to also use that technology to do a very quick test to ensure that at least we have first-hand information on any suspected area or sites that need some interventions. And I think we will continue to do that and build on the data so that it will be an evidence-based, policy direction rather than we speculating and thinking that something is being suspected. But then this time around, we are going to back it with enough evidence to get government attention to support, us to do the work. International cooperation and technology transfer, as I've already indicated. Now we have the technology available. Our responsibility is to use it, economically and then wisely to ensure that we get the best out of it. And the data that is collected, we need to also make sure there is a hub that this data can be actually put and then share among ourselves for use. I say that, and I always continue to say that data, when we collect data and we are not using it for its intended purpose, then it means there is an issue, because it doesn't mean anything when we are not utilizing the data that is being collected. So please, see an institution strengthen enforcement of environmental regulation, monitoring and waste, promote recycling technologies, support research and public health surveillance. And I know University of Ghana, other universities are also doing a lot of research, but then we need to make sure this research are interconnected from the academia, the regulator, among other institutions. This data is shared, and we have to continue to do it to make sure we benefit from it. Integrate environmental justice into national policies. And environmental justice is, as I've already indicated, fundamental. And therefore, we need to do our best to come out with policies that will ensure that the people of Ghana and our neighboring countries are safe. Can we move on, please? So in conclusion, ending lead poisoning is a public health priority. It is also a constitutional and human rights obligation. Protecting children and women must remain a national priority, and collective action is needed from government, industry, and civil society organizations. And ending lead poisoning is protecting our future. And I'll end here, and thank you so much. I know I've exceeded the time small. I don't know whether it's more small.
Now I understand the so you gave when I said 10 minutes.
So I was trying to be very brief,
Yeah.
in fact, but forgive me for that, for extending the time.
Thank you.
Prof,
Thank you very much,
for the
Mr.
opportunity.
Ejipon. I must say that these insights you have shared are very thought-provoking. And in fact, you couldn't have done any more justice to this than you did, bringing to light the collaboration you have with Pure Earth to do the kind of research you do, and even telling us here on this call that environmental protection is both a civic responsibility and that of government. And so I am I thank you so much for bringing this dimension to this issue. I would invite our next speaker, Dr. Kuti, to give us his talk on the systems that allow lead exposure to persist, especially among children and marginalized communities. Dr. Kuti, I don't know if I should say you have 10 minutes.
I'll try my best.
I would say you have the floor.
Thank you, Prof. Thank you so much. And of course, when a prof tells you that you have 10 minutes, then you just have to find a way to squeeze out what you have to do within that 10 minutes. And I also must thank Mr. Hobson. Hope I'm pronouncing it well. Well, first of all, I hope everybody can see my slide, can hear me clearly. I'm assuming.
Yes.
If not, thank you, Prof. Thank you, Prof, for the feedback. And I'm quite I'm already learning, from this webinar. I'm not just presenting. Even starting from the Africa director for our honorable reverend. I needed to update my slide, not just this one. I didn't know that the new figure is now 1 billion children. As I used to use the 800 million, but now the new estimate that's waiting to be released now 1 billion, and that is quite instructive to actually show the extent of the problem that we're trying to address. Like I said, I started a new innovation, social science, social enterprise called Afia Lafia, which in a way, for those of us from West Africa, the Lafia means health, the Afia means health in the East Africa, because I can imagine people from East Africa also on this call, and that's our mission statement. Sorry for some marketing there, Prof, and everybody on the panel. Now, the toxic truth, I just need to quickly put this here before I now go on to now talk about why does this problem persist? We do know that 1 in 3 children globally, are already poisoned with lead, and there's no safe level of lead contamination. The science, behind what is causing this is clear. We know why this is happening. We know the effect in terms of the, cognitive impact, the long-term cardiovascular impact, the long-term translation to the loss of productivity and the economy and the GDP loss, to all of this. And we do know that the bulk of at least 30%, majority of this source of lead exposure is from unsafe recycling of lead acid battery. I will talk more about that, later on in my presentation, why that is also very crucial for us to look at. Of course, other sources, just as we mentioned, paint, through our water, and of course, through spices, cosmetic, household products, and even toys that children might be playing with. But for me, I want to position my talk this afternoon on 2 critical points why this problem persists. Some more like a hardware and software. The hardware, as we all know, might be more difficult to change. But the software is something that, over time, we can keep working at, and keep working on. The hardware is the inequality. There's a strong inequality, both at the national, household, community, and even at the global level, that actually contribute, to this large pool of children and pregnant women in low and middle income countries being lead poisoning. Then, of course, the systems that are meant to respond, to whatever challenges we are facing in this country are also being challenged. But if you can quickly fix the system, the hardware also, we can find a way of addressing them. So those will be my 2, anchor, or my 2 fulcrum of my argument this afternoon in this presentation. So let's look at the inequality geography. In my little years of work across African countries and some other countries, you always see these places, this urban poor area where you have most of these problems. It's Agbogboloshie in Ghana. Sorry if I'm not pronouncing it well. It's Ogijo in Nigeria. It's Dandora in Kenya. What is common to all of these places? They're generally unplanned. They're generally overcrowded. They generally like social services, and they generally, like economic opportunity because they're also, you have a lot of people being congested in a small area, and people there are trying to hack out a living. And as such, they're involved in all kind of activities, that quickly get them a quick buck, get them some quick money to be able, to for their livelihood. And lead, as a product, is a very highly recoverable, recyclable material. And as such, people tend to gravitate towards unsafe recycling of lead and use that product for other product manufacturing. The evidence to this, thanks to what Pure has done, there's what is called the Toxic Site Identification Program. I will encourage you to just go and look at it, and you'll see in most countries, actually, we have close to 5,000 data sets in this wonderful piece of work. And you could see in different countries, in different townships, in different cities, where these sites are located. So really, it's not as if we do not know. We know where these sites are located. But the question is, what do we do about it? Because these are structural drivers of inequality. Households, communities, schools that are located in this area are invariably already, prone to being lead poison compared to other households than the other parts of the cities. Like I said, these are evidence of the clustering of lead exposures determining by the geography, by the location of where a child or a household or a community located in a township, in a state, and in a country. So that in itself is one of the key reasons why do we have these 1 billion children who are lead poisoning. Then we now start looking at the software. The first one, which all of us, I'm sure, will agree with, is that, and I'm happy, that Mr. Hobson have talked so much about what some of these other government agencies or the government owning to the responsibility to actually attend to this problem. Because the truth is that we talk about inequality. The right holders are the children, and of course, the pregnant women who are already, in the course of bringing up the next generation. But the duty bearers are the government, the civil society, the family, and the community at large. So we owe it to them to actually uphold their right to an healthy environment right from pregnancy and through their first few years of life until they attain adulthood. But now, what do we currently have? We have some weakness in terms of weakness in the institutional capacity of the different government agencies, the ministry, the different agencies, and the department that are expected to actually, put in the right regulation and enforcement to be able to ensure, key interventions to prevent lead exposure. Then, of course, we need also to get people to be aware of the risk itself. I was talking with Nana before this presentation, and was saying that lead is something that is there, yet is invisible. It's a risk that is prevalent, but yet people do not see it. And so you need skill to be able to communicate properly about this risk to the environment and get their buy-in and their involvement in being able to prevent the exposure itself. Key monitoring weaknesses is in terms of who is tracking our household goods, the purchase of food, tracking the water, tracking the paint to ensure that all these potential sources of lead exposures are being addressed. Then, of course, there's no way you talk about use lead acid battery management without talking about the waste management itself. Agboloshe will not stop, or Dandora will not stop tomorrow. Why? Until we actually have a system in place to address the waste, to look at the entire life cycle of a lead acid battery, especially with the fact that realizing the fact that lead itself and as hazardous product is not something that should be handled you should just be handled like that. It's something that we need to have a dedicated effort to look at the waste management through the entire life cycle of the product itself. Gaps in our policies and our governance may also account for this weak regulatory ecosystem. Then one other key factor, because lead exposure, the sources of cells are mirrored, they're ubiquitous, they're everywhere, starting from the paints to the source of water to the cookware to different sources of water. You need strong collaborative effort with all the institutional government regulatory institutions, agencies, ministries that are involved to be able to work in hands to be able to address this problem. I'm also, once again, I still have to still talk about that. I'm so glad that Mr. Hobson is here. And Ghana is showing that example, realizing the fact that you have to work together in a collaborative effort, because if you do not, then this, as it's why, is a difficult thing to chase, and we may be missing a golden opportunity to be able to address this problem. So, because if we work in silo, it's not just the Ministry of Health, it's not just the Ministry of Environment, it's not just even the Ministry of Energy or even Aviation. All ministries, line ministries, to a large extent are involved and needs to, to find their position on the table to be able to have a coordinated effort. If not, we end up with poor accountability and, of course, a wasted opportunity to be able to address this problem. And for the unborn children and for the 1 billion that are currently poisoned. Then, this is one key slide that I'm also quite excited about. The truth is that we cannot continue to chase, it's like a cat chasing its tail. Yes, we know where the sources are coming from. But the issue is that, we have to realize the dynamics of where these sources are coming from. Use lead acid battery as a major source, as a key source of lead exposure, as a source of lead exposure. But we also have to be mindful of the fact that, why do we have this large number of lead acid battery coming onto an environment on an annual basis? Let me use Kenya for an example. We have 4 million registered car owners. The average lifespan of a car battery is 2 to 3 years, meaning that every year, 750,000 used lead acid battery is going to come to our environment. Unless if you have a strong system for collection, storage, and transportation of this lead acid battery, they will end up in Dandura, they will end up in Gbogboloshe, and all these other sites that people recycle lead acid battery unsafely. Then also, we also have to be mindful of the fact that why that is a problem emanating from the urban area, from the rural area. Majority of some of our township or rural areas that we are promoting the use of solar green energy. Lead acid battery is also being used as a storage for most of these solar projects. So invariably, whether we are running away from it from the urban area or from the rural area, lead acid battery storage is happening. And every year, a large number, an appreciable number of used lead acid battery is coming to the environment. So how do we handle this? Until we have a proper closed circuits recycling system, a true definition of the circular economy, borrowing for what happened in Brazil, to be able to ensure that every used lead acid battery, is stored, is deposited and stored and recycled in a very proper manner and environmentally sound manner. The knowledge is there, but to actually doing the hard works, the heavy lifting to put the system in place is the challenge. Then whether we like it or not, Mr. Hobson, sorry, I'll keep referring to you, talk about globalization. Whatever happened in Ghana or Kenya or other parts of the world, to a large extent, is also being influenced by what's happened at the global level. We need to be mindful of the fact that, hazardous waste itself, there is this concept that people talk about, they call it hazard displacement. Despite the fact that we have the Basel Convention, which actually is a protocol that regulates the movement of hazardous products, lead being one of them. Because in the developed country, there's strong, environmental regulation in terms of enforcement. Labor, to a large extent, is also quite very expensive. Regulation and abiding by proper regulation for a circular economy is also happening, as should. So what happened? We end up having a situation where most of these hazards, in quote, are shifted, to the developing country. Most of the recycled lead acid battery, ends up in developed country, and that itself is a driver of a structural inequalities of between the rich country and the lesser endowed country. So we need to find a way of actually being mindful of this problem and making the polluter pay for some of these things, and making them to be aware of the fact that yes, we have a problem in lower medium income country, but this problem is not entirely due to what we have on ground. I think the next slide, oh, sorry, if I get that. Yeah. So yes, I think still within time. For me, the key take-home message is why this, problems still persist. Having talked about, the structural inequalities and a different weakness in some of our systems, and of course the global dimension to the problem that we're confronting in lower medium income country is that it's not just an environmental health problem. It's not just for the Ministry of Health, but to a large extent, or the Ministry of Environment, or for other ministries or education. But a large extent, it is a sign of a systemic failure. And this, in a way, you have interaction of the different systems, working together to actually accentuate and perpetuate some of these inequalities that we'll be talking about. And this will continue unless we find a way of addressing it in a coordinated, intersectoral, and very, very innovative manner, with everybody working together, with everybody realizing that the right, to an healthy environment is enshrined in some of our legislature and some of our legal instruments. And it's our responsibility, civic responsibility, even as a car owner, to ensure that when you're changing your car battery, the battery is deposited in a place at a point where it will be transported for proper recycling and not end up in the dump site. It will not end up in Dandora, Ugijo, Uloshi. We also need to find a way of making sure that any form of fragmentation in our social service sector are also addressed. Everybody needs to work together. And of course, I talk about the inequality and the structural vulnerability that we also need to address. I think for me, those are my key points in addressing this. This is something that we're trying to work out in Kenya to be able to have, and possibly, it's an idea that we're still working on, that just like every car owner knows where to refill, when you need to refill, to get fuel for your vehicle, we can look at an arrangement where these fuel stations can actually be a safe spot for you to drop your used lead acid battery. 750,000 car battery coming into the environment, unless you have a structured system in place, whether we like it or not, some of them will end up in a dump site, and some of them will end up being used for unsafe recycling and end up polluting our environment. Thank you so much, and it's been a pleasure, presenting this afternoon.
Thank you, Doc, for this presentation. I believe my audience and other speakers would attest to the fact that this dimension, as you have taken this discussion, is one that is very informative and also thought-provoking. And in fact, both presentations keep mentioning monitoring and weak regulation. For Mr. Ejapon, he calls it stronger regulation. And one thing that you have said that has sat with me is that this is not just an environmental issue, but a systems failure. And I like the last slide that brings that innovation of collecting the lead batteries. Thank you so much for this, and I believe our participants and audience are listening and have their questions, so that when it's time for questioning, we can have questions and comments from all of us. Thank you once again, Dr. Kuti, for your presentation. It's now my pleasure to invite my own sister, Dr. Marianne Sapper, to also give us her talk on geochemical legacies and landscape contamination, understanding the environmental fate and persistence of lead. Dr. Sapper, please, the floor is yours.
Thank you very much, Prof. And I'm grateful to yourself, Pure Earth, and their collaborators for the opportunity to be on here today to have this conversation. Let me try and minimize this. I hope my screen is visible. I'm sharing my screen and I hope it's
Yes.
visible. All right.
Yes.
Okay, so listening to the previous speakers, I noticed there's gonna be a lot of overlap in the conversation because the salient points, the important things that need to be discussed, run across all the talks that we've had so far, right? And so I noticed Dr. Kuti has handled into much detail the human rights, the justice, the societal, economical aspect of economics aspect of things. Mr. Japan has done the same. And Mr. Japan has focused a lot on the policies and the regulation aspects of things. So my job here is to try not to repeat so many of those things and try and focus on the geochemical legacies. What I mean by that is naturally, right? There are elements. There are 118 of them on the periodic table, 94 of which are naturally occurring elements, right? So what is the issue with lead that is creating this environmental problem that we are dealing with? All right. Elements all have geochemical behaviors, the way they participate in the earth systems, the way they interact with the earth systems. Right. So my focus is sort of going to be on that to discuss the natural why of it, right? The geochemical aspect of things. And I've titled this the Geochemical Legacies, Understanding the Environmental Fate and Persistence of Lead, right? Which is what is leading us to the lead poisoning and the issues associated with that we want to do away with. Right, so the teacher in me would definitely want to start with the very basics. What lead is, we all have a general idea about it, that it's an element. But what I want you to take away from this slide is that it's a heavy element or a heavy metal. What this means is by density, yes, it's heavy, but the important part for me is that you understand it's toxic. For us geochemists, when we say a heavy metal, we are almost always referring to toxic metals, right? In the periodic table, metals that are toxic. The other thing I want you to take away from this slide is the fact that lead is naturally occurring. Right? It's there naturally. The geological systems form lead, right? But it's usually diffused. And then over time, these geological processes over millions of years concentrated the diffused lead into the ores that we are interested in mining to produce the products that have lead in them that we end up being affected by or interact with and end up being affected by, right? So the takeaway from this slide is the fact that we have natural backgrounds of lead, which we refer to as what the geological background. But once you start concentrating it through geological processes, and most importantly, and in this context, anthropogenic activities, which is things that we do ourselves as human beings in terms of industrialization, manufacturing, civilization, the good thing we want to do as human beings to be comfortable on this earth. We try to concentrate the metal, lead, and then start creating major problems for ourselves. So I put this slide on to sort of have an executive summary, if you will, on if you don't believe anything else. I mean, the World Health Organization has eyes on this, right? So I sort of wanted to use this as an overview, right? But my previous speakers have done justice to it. There's no point of me going over the fact that lead is problematic. It's a global issue and we need to address it. Same for this slide, but the takeaway for this one is mainly the sources, right? Where it's coming from. And I think the previous speakers have dealt with this as well. But if you do pay attention to the sources, right? Some of the things listed here, jewelry, glassware, crystal glassware, ceramic glazes, toys, traditional cosmetics. It brings to your mind the fact that these things are all around you, and it's very easy to be exposed to them, or you are easily exposed to them. All right. Okay. So in terms of the geochemical aspect of things, I would like you to keep in mind some concepts, the relevant concepts that make lead an issue, a legacy issue, all right, a contaminant, for lack of better words. You need to understand the basis of the why of it, and these concepts help with that. Right. So persistence is the first thing I put down, right? The half-life of lead, if you've done any kind of chemistry before, you know lead is also radioactive, which means it decays, it breaks down into other forms of lead and other elements, right? So, and this happens for a long period of time, which we refer to as the half-life. Like it stays in the Earth systems for a long time, changing into other forms of lead, other types of elements, right? So the half-life of lead in the soil is measured in centuries to millennia. Okay, so this is a long time. How long is the lifespan of a human being? Okay, in comparison. All right. Mobility. Lead is relatively immobile in soil, meaning contamination remains concentrated in the top layers where human contact is greatest. This is important. The mobility or immobility of lead in the Earth systems, particularly the fact that it's concentrated in the top layers of the soil, it's superficial, means we have easy contact with it. All right. It's not hiding in the deepest depths of the earth that we can't reach. It's on the surface. So access to it, it's our interaction with it is very easy. The bioavailability of it, we have to bear in mind that not all lead in the soil is equally dangerous, right? Lead at certain levels in the soil is even beneficial for plant growth, organisms, or the soil systems to work. But again, remember that the concentration of it, concentrating it and keeping it in the top layers of the soil is the main problem. Right. And then the chemical forms in which they occur dictates how easily it's available to be absorbed into our bodies. So what's the legacy problem? And I refer to the word legacy, the term legacy. What do I mean? It means it's persistence and it's there. The English definition or understanding of legacy means it's been there for a long time. Other generations will come and meet it. That is legacy. Okay. So the legacy problem for lead, I already mentioned persistence when I was giving you the key concepts, but it comes up here again, that lead is an element and not generally referred to as a compound. It behaves mostly in the Earth systems elementally. It interacts with other elements and form compounds, but at its basic form, it's an element, right? This means it does not break down or is not destroyed by biological or chemical processes. So an atom of lead from a 1920s, 1910s, the 1800s smelter is still an atom of lead in the soil today. Again, because of the half-life, how long it takes to break into other types of lead and other elements and all that, right? So it's there, it's persistent in Earth systems. Its environmental fate then means once it's released into the environment, Through our activities, mining, smelting, or the use of leaded products, it binds with organic matter and clay particles in the soil and sediments and creates the long-term geochemical reservoirs or legacy contamination that we are dealing with. All right. So in short, to take away from this slide, lead is best understood as a permanent geological toxin, an element that is naturally present, but when concentrated and dispersed by human activity, it creates a virtually indelible legacy of contamination in our environment. If that was not clear enough, I have it in bold letters to say that, so unlike organic pollutants that can break down over time and be recycled through the earth systems, lead is an element that does not break down. It is permanent, right? So it is permanent and permanent on the surface, the top layers of the Earth's crust, right? Which is what really contributes or what it means for it to be a geochemical legacy issue. All right. So for us to have lead in a geochemical cycle, so when I talk about cycles, I'm talking about the interactions of the different earth systems, right? Land, water, air, ice, plants, okay? If I mention cycles, I'm referring to that. So for lead to behave in a geochemical cycle, we need to have a source of it, right? It has to come from somewhere. We know it's naturally occurring, so it comes from the weathering of rocks. But overwhelmingly, the anthropogenic activities concentrate it more. So mining, smelting, industrial emissions, leaded fuel, lead-based paints, etc. All these sources contribute to the accumulation or the concentration of what? Lead in a geochemical cycle. All right. Then you need a pathway. How is it moved around? How is lead in these systems? How is it traveling about? All right. So we have through the air, we have through water, through plants, which we would usually refer to as our food sources. Okay. And then you need a sink. There should be a reservoir that is accumulating this element. All right. So the soil and sediments are the ultimate repositories for what? Lead sinks, right? It keeps lead in the system. Okay. All right. So again, going back to the issue of the mobility or immobility of lead in our soils, right? So this is a table really quite technical, trying to explain the different parameters that are involved in this. And then the immobile state of lead and the mobile state of lead. This is important because I want you to understand that the immobile state of lead is the rule that it stays in the soil, bonding with organic matter and clays. That is why it's a legacy problem. It doesn't move around a lot. It's immobile, all right? But then it does, under the right conditions and situations, it moves around deeper into the earth systems, move around into water, into air, cycling itself through the earth systems, as I mentioned earlier on. Okay. So the takeaway from this slide for me is, at which depths are the problems being created? So the shallow accumulation, right? So lead remains concentrated in the top layers, creating the long-term geochemical reservoir, hence the legacy that we are discussing, due to its immobility. All right. If we come to its mobility, lead can move deeper into the subsoil and potentially threaten groundwater systems, aquifers, and things like that. But the major problem is coming from the fact that it's immobile and we have the shallow accumulation of lead. All right. So the primary skills, risks that this presents is the fact that it's on the surface, it's shallow accumulation. So there's direct exposure through ingestion of soil dust, inhalation, gardening. I mean, your backyard. If you bought land that was previously used for any form of um, human activities that involve lead, it's still in that soil. You go and buy that piece of land, you put your house on it nicely with no idea the type of contamination you have lying underneath you, right? So you're in your backyard gardening, and then you are hearing all types of issues about people in the family getting sick, dying of cancer, cardiovascular issues. It's all connected. Okay. So then for the for the mobile aspect of things, groundwater contamination, of course, and then once it's in the F systems cycles, we just keep going round and round. And this slide shows that the image I put on this slide is to try and show you the cycling I'm talking about, the sources from which you get the lead, how it's converted into different forms, how it interacts at depths, at different depths, what is happening where, pretty much, right? So the definition for the geochemical legacy concept, right, is that the historical accumulation of lead in the environment that poses the concentration of lead, right, in the environment that continues to pose a risk long after the original activity has stopped, right? Whatever was being done, whatever concentrated the lead, that activity is long gone, but the lead is there. So it's historical accumulation that is being cycled through our F systems, right? So that activity has happened many years ago, right? But it's still in our soils today, right? When it comes to lead, the past is not the past, it is in the soil under our feet, right? So what pathways do we end up getting lead into our systems? This has been explained already from the previous talks, practically through ingestion, inhalation. There are ways in which it can be absorbed through the skin, but that is minimal or less common. But the most common is through ingestion and inhalation of lead in its different forms, isotopic forms, elemental forms. However, it's cycling itself through the F systems. So even low-level exposure through these pathways can lead to significant health effects over time, especially in children. This has been said severally and explained. With this slide, I want to try to tie this understanding of the geochemical legacy of lead to the human rights and justice issues. So what I'm trying to do with this slide is to look at the different geochemical legacy stages and see how I can tie that with a human rights and a justice issue, right? So for instance, at the liberation stage, this is when we've accumulated the lead, and our own processes like mining and smelting is giving it space or pathways for interaction, for easy interaction with plants and animals, right? So the liberation of the lead. The human rights and justice issues I see there are that industrial activities are often located near or impacting marginalized communities. Dr. Kuti already said this. Mr. Japan already said this. Right? Mobility, how the lead moves around in the geochemical cycle and the F cycles, right? The human rights and justice issues I see there are the systematic inequalities associated with this. So this contamination or these types of pollution is not evenly distributed, right? Waste sites and polluting industries are disproportionately sited near low-income communities. And if you add race to it, usually communities of color, right? So weak regulations and systems allow this to happen, right? The bad things or the things that are usually not very good for us are always situated in the communities where people can't help themselves. And the exposure, okay. When these things happen, human rights are automatically violated. Your right to health is automatically violated with or without your permission. You live in that community, you live in that environment. You don't have the means to move away from it, but the activity is going on there, or the activity has gone on there already, and the legacy is still there, right? So, of course, we've mentioned women, children, men, everybody, right? Our rights are important, and then we should have a say in what affects our health. Right? But in most of these issues, we don't. Okay. The public health consequences, they've been mentioned, several of them. I don't need to go through it again. But the takeaway here for me is that lead poisoning is a silent cumulative public health crisis, right? It's often invincible until the damage is done. Like I said, there are so many of us living on and interacting with the geochemical legacies of lead with no idea about it. We don't know. We just innocently built our house. We just innocently started a business. So without any knowledge or understanding of what's beneath our feet, right? So the vulnerability and environmental justice issues associated with this, who is most at risk? We've said it. Children, women, everybody generally, but mostly children, right? Low-income communities near industrial or mining sites, informal settlements, malnourished children are particularly even more affected because they are deficient in calcium or iron that absorbs more lead, without which they absorb more lead, right? Why this issue is an equity issue or an equality issue, right? Because the contamination is often spatially concentrated in marginalized communities. This links back to the previous slide. And these communities have less capacity to relocate or remediate, right? And so their historical pollution becomes a modern type of what? Injustice. Something that has happened a long time ago that you have no idea about. You are suffering for it now. So for me, as a geochemist, a call to action is to say that geochemistry should serve not only as science, I mean, for us to be in our labs, doing our analysis and pushing out publications, no, but we should be able to tie it to the justice of lead poisoning and its impacts, its effects, right? And we can do this by mapping contamination. And this should be the first step towards protecting the most vulnerable. All right. How do we do this? Using geochemical solutions. How do we do it? The first thing is geochemical mapping. I think Mr. Japan has touched on this a little bit, but the kind of work the EPA is doing, trying to figure out where the contaminations are, pure earth as well, where areas that are problematic and all that. So for me, the call to action is to do these things for the entire country of Ghana, for example, if our focus is on Ghana. Have a geochemical map, if it's only just for heavy metal saving, right? So that we have a baseline and then we know where the issues are, right? Geochemical soil surveys can create high-resolution risk maps to target interventions. So if we know where the problem is, we know where to bring the solution or take the solutions to. It will also help for us to do land use planning. So we prevent schools, homes from being built in hotspot areas, places that have problems. And then it also helps with targeted remediation, right? Like phytoremediation, using different types of plants to stabilize the soil and extract the lead from the soil, etc. Isotopic printing is important. Elements behave as isotopes. Lead has several different types of isotopes, and isotopes have different signatures. It means they behave differently in different systems, the different F systems. So different isotopes of lead will behave differently if they are in water, if they are in soil, if they are in the air. All right. So this helps us in terms of applications, right? So we are able to analyze and determine the exact source of the contamination, right? So if you sample a child's blood, right, for lead, or you have a soil sample, you can determine the exact source of that lead contamination, where it's coming from, using its isotopic fingerprint. And this helps us in enforcing accountability. Mr. Japan suggested several things to address this. This is one of the ways to do it. Data. He said you can have data and be meaningless, which is true, right? So using the data in ways that are beneficial, this is one way of doing it. If you have isotopic printing, it provides legally defensible evidence to hold corporations or historical polluters accountable for cleanup costs, right? So you did it, come and fix it, because we have the isotopic fingerprint that this is coming from you, right? And your processes, okay? So it shifts the burden from prove it's harming you to prove it's not from our site, okay? So when people
Hello, can you hear me?
Yes, we can hear you.
Oh, okay, so it's from Dr. Sapa. Okay, so Dr. Sapa's line dropped briefly, and I would say that she has been making very insightful points, which I think she has thrown a lot of light. Dr. Sapa, are you back?
Yes, I'm back. The lights
Yes,
just
we
went
missed
off.
you. Yeah, momentary. So maybe you would like to wrap up so we can take it.
Okay.
Yeah.
Okay. All right. I'm almost done with that. So just going back. I don't know where you lost me, but yes, I was
Oh,
talking about.
just that last slide that
Okay.
accountability is
Yes.
right
All
there.
right. So it helps with, like I was saying, it helps with enforcement, and then it helps empower communities. If they have the right data, then they are able to stand up for themselves. I put this slide together to address the case of Ghana particularly. So I sort of looked around to figure out what's going on, particularly for the case of Ghana, using information from UNICEF, Pure Earth, the EPA, the FDA, and other academic journal publications. And the main points I was able to gather is the fact that we have issues from this emerging from industrial and legacy mining, of course. We have a very vibrant extractive industry. So this contributes to that. Informal industry. The agbogboshi has been mentioned several times. There are other types of waste disposals that are contributing to this problem here in Ghana. And of course, in terms of the intimate pathway of interaction with this lead contamination or lead poisoning is through consumer products. And in Ghana, it's usually through our food supply, makeup, cooking utensils, and things like that. And I think Pure Earth has substantive data information on that, and the EPA as well. I put this slide down to just show you something I found concerning the toxic sites identification program, which was developed by Pure Earth, and a study in 2016 that highlights the specific sites in Ghana that have toxic waste. Right. What stood out for me is the contribution of lead at these sites, at these different sites. So lead is in blue over there, and you see that it's the major contributor to the toxic waste that has been identified in these programs. For me, this was 10 years ago, 2016. Things have since gotten worse with illegal mining, our waste disposal, and the quality control of our consumer products. So I leave the result of that to your imagination? Has it gotten any better? Is it getting worse? No, that's for us to answer. So in conclusion, I want to say that lead is geologically permanent. Soils and sediments are the primary long-term reservoirs of exposure. Its geochemical legacy is the physical basis for environmental injustice. Right? If the geochemistry wasn't there, we wouldn't have the environmental issues we have that are leading to human rights and injustice issues. Right? And the geochemistry can still provide the tools for targeted action and accountability. My final thoughts on this is that we cannot make lead disappear, but by understanding its journey through the Earth's processes, we can build a future where it's no longer finding its way into our children. All right. Thank you very much.
Thank you so much. Thank you so much, Dr. Sapa, for bringing the science out and communicating it to the barest minimum that we, the non-scientists, also appreciate and understand that lead is a heavy metal, and for that matter, by its nature, it is toxic. And we have also heard from all three of you. Somebody said it's silent, somebody used the word ubiquitous, you used invisible, and that even at the lowest level, it can have significant health issues for us, especially the children and vulnerable in society. These are thought-provoking, and I would say that I thank all of you speakers who have made time off your busy schedules to put these beautiful talks together to educate us on this webinar. So without much ado, I would want to ask for questions, request for questions from our participants. If you have questions, you can raise your hand or type it in the chat, and I'll gracefully read that for the speakers to address. We have some questions, comments, contributions. Okay. You can unmute. Okay, I see a hand up there. Nana AJ Sikapa.
Yes. Hey.
You raised your hand. You have some
I just
questions?
realized maybe it's just, I just pressed something, sorry.
Okay. Our participants. Okay. So if there are no questions, I want to ask all the...
Hello.
Yes.
There's a hand up.
Yeah.
There's
I have
a
my
hand
hand
up.
up.
Oh, okay. I didn't see that. Okay, that's Anthony Atta. Okay, please go ahead.
Yeah, thank you very much for the wonderful and insightful webinar. I'm so grateful for all the speakers. I want to first ask, please, could they make the slides available to us and the recordings? That is one. And two, during Dr. Sapa's presentation, she spoke about how lead finds itself at the surface of the earth. And in a way, it leaches into the water bodies that are around us. I was not clear there. If she can be of a help by clarifying that one to me. And the isotopic nature of lead being present in different, when it's in the soil is different, when it's in the water is different. If you can help me out in that vein, thank you very much.
All right, Prof,
Okay,
should I
Dr.
go ahead?
Safan. Yes,
Yes.
please do.
Okay, so Mr. Anthony, to address the first one, I'll go back to what I said about the mobility of lead, right? What that means is by its natural geochemical nature,
Yeah.
right? So all elements on the periodic table behave certain ways geochemically. We call it geochemical behavior. They have preferences for which systems they want to participate or interact with, what types of reactions they want to participate and interact with. This has to do with the atomic structure and all that. So some more detailed stuff. So let's just say all elements have their specific geochemical behaviors, which helps us to understand how they behave in different processes, interact in different reactions, participate in different reactions. So for lead, it's an immobile element, mainly, meaning it's not very soluble, right? It will not easily dissolve in water, right? But it would attach itself to other compounds, specifically organic matter and clays. It likes doing that more. We call it a charcophile. Another thing, which means it prefers to interact a lot with things that contain sulfides. All right. So based on this particular geochemical behavior of lead, it means it's going to accumulate more in the topsoils or the surface of the earth, whether it's in soil or sediment or surface water. Okay, because it takes a bit more better conditions or other conditions or situations for it to start leaching deeper to get to aquifers and groundwater, etc. Right. But then other sources like smelting, recycling, and all that move it through other mediums apart from soil and sediments, right? Moves it through other mediums like the air. If you have smoke, that's an easy way of moving lead into the atmosphere through the smoke. If you have dust from mining, right? So you excavate material to go and all material to go and process it. This all contains lead. Once you are moving the material, the dust associated with that makes its way into the air. That's another way of getting it into the system, particularly the pathway of the air. But your question was particularly regarding to the soil, and this has to do with its particular geochemical behaviors. If we think of lead as an isotope, right? What I was referring to as isotopic fingerprinting has to do again that elements have isotopes and lead has different types of isotopes. In an isotopic form, it fractionates differently in different systems, meaning some of the isotopes are heavier than others, right? So if we take the process of evaporation, for example, if I have a heavy isotope of oxygen, for example, which is oxygen 18, and I have the less heavier isotope of oxygen, oxygen 16, and we evaporate, we will end up having more of oxygen 18 in vapor in the air and more of oxygen 16 left in the water because of the other way around. We will have more of oxygen 16, which is the lighter one, evaporating, moving along with the air, and then the heavier one remaining in what? The water. Just because of that slight difference in what? Their mass. as 18 and 60. The same applies to lead. So if you are in a system that has lead in the system, depending on the isotope you are dealing with, it will be behaving differently or being accumulated differently in different systems. So I don't know if I've answered your question or I've confused you more, but I hope I've answered it. All right, thank you.
Thank you so much, Dr. Sapa.
Hello.
Thank you so much, Dr. Sapa, for the explanation. To link that up, someone put a question here that would also, you have answered it partly. How does lead from industrial waste like slag migrate into soil and water systems? So you have answered it in the preparing, but maybe you want to touch a little so the person.
Yes,
Did you get it? Yes.
Yes, in that case, I would relate it to a common process we are all aware of, rusting, for example. All right. So if you have slag, it's a composition of I don't know the exact kind you are thinking of, but I'm assuming you have metals in the combination of metals in the some form of ore or refined slag, whatever it is, right? But yes, the interaction with other types of elements in that system in combination with water, air, right? That's the weathering. In this case, what I'm referring to is the rusting here as weathering, right? So that's a form of breaking it down, right? And then you end up with components, different types of components of lead and other elements, other metals, right, in the system primarily. And then they start trying to find their ways around those that remain in the sink or the reservoir, remain in the reservoir and attach themselves to other compounds, other organic matter, other things of interest that they like in that sink. Those that are easily soluble or easily volatile or evaporate, they find their way through those systems or those processes and move around. So there should be some form of breakdown to help with that.
Okay. Thank you so much. Dr. Kuti, you have something, you want to add something, yeah? I see your
Sorry,
hand up.
not too hard, because I'm learning
Okay.
so much from Dr. Mariam. Of course, not being is he biochemist? I don't know. It's your chemical engineering background. I'm talking about Dr. Mariam. I just wanted to ask this. I find this isotopic fingerprint fascinating. Is it a universal fingerprint, or it is unique? Because borrowing from what I know about biology, fingerprint is unique. The reason I'm saying that is that I've read about some studies that actually use this methodology to be able to identify that the lead poisoning that they observed in some children and pregnant women was from turmeric spice that was adulterated with lead chromate. So what was done in Bangladesh was that they were able to establish that some pregnant women were lead poisoning. So they wanted to know what was the source. Was it turmeric? Was it the cookware? Was it the what's it called? Unsafe lead acid recycling? And they were able to use that fingerprint to pinpoint that it was from the turmeric that the women were using. So what I wanted to say was that can we borrow that knowledge, let's say to Kenya or to Ghana, that okay, we've been able to identify some children that were lead poisoned. Can that fingerprint help us to know that these children that were lead poisoned were from turmeric or were from lead acid battery? So I just wanted to know how unique and specific is this isotopic fingerprint printing for lead?
That's exactly it, Doc. You've answered the question yourself, so I don't have much to add to that. They are really specific to specific processes, right? So, like you said, you are really able to separate an isotope of an element that is in turmeric from something else. Yeah. So it's exactly that. That's just it. So it's being used in forensics even to catch criminals because isotopes behave differently in different places. So if we have a certain type of soil in an area, we can have its isotopic signature of different
okay.
elements, be it lead, oxygen, whatever. All right. And that is different from a different type of soil in another area. So if you are wearing shoes that you used to walk in this soil to commit the crime, and I compare it to another type of soil, I should be able to tell this is where you did what you did. So it can be really, really specific to different processes to help separate these things.
Thank you so much.
Yes, thank you. Thank you so much. There is another question in there. Why are children more vulnerable to lead poisoning compared to adults? I think any of you can take that question, maybe Dr. Kuti or Mr. Japon.
I will just suffer my own little biological knowledge. Children are more vulnerable. Number one, children absorb lead more and they retain more than the adult. Meaning that when a child or an adult, a child and mother is exposed to lead in an environment, the child will retain more. I think 7 and 4, a proportion of a ratio of 4 times than what the adult will retain. Secondly, because of, and of course, children, they have a smaller body size and a larger surface area. Thirdly, also because of some key practices, or should I say activities, that children involved with. Children generally, when they are playing, they play on the ground, they use their hand, to pick up things. They do a lot of mouthing to explore. They explore things with their mouth, and so they do a lot of explore things with their mouth, and as such, they're able to, introduce through injection, whatever it is, when lead is in their environment. And then, of course, maybe the other point that comes to mind, which I also find fascinating, is that lead paint or lead product as it were, lead in itself, there is some report that it actually has a sweet taste, called sweetish taste as it were. So a paint having lead or something having to has a sweetish taste. So that in itself, a child that is, going around picking things from the floor, from the ground, and come across some paint that's scraping off the wall and introduce it to his or her mouth and it's sweetish, the child will tend to continue in their practices. So those practices, physiological differences, and then of course, that children generally retain lead when they are infected, when they are exposed, compared to adults. That's why children are much more.
Yeah, thank you so much. Thank you so much for, you have answered that question. And remember, Dr. Sapa made us understand that lead is usually found in the shallow layer, okay? There's 0 to 5 meters of the soil. So we have our kids always there. And our kids, their immune system is also not well developed. So yes, they are prone to that also. So that is what makes it. Thank you so much. Okay, Dr. Kuti, in his conclusion, suggested that gas stations have containers for old batteries to be deposited there during their end of life. My question is, most U labs are removed by mechanics. What is the involvement of mechanics in the U lab retrieval? Dr. Kuti.
Yeah, very, very good point. And that is why the concept of extended producer responsibility comes in, wherein the reason why we're suggesting some of these, what's it called, some of this forestation or even car wash, is that, to be honest, a battery seller, do not really have enough space to contain the used battery. Somebody that is selling battery, but in a shop, doesn't have space to actually be keeping the whole battery. It would have been more appropriate to say, okay, as you are picking up the new battery, drop the whole battery. But with the extended producer responsibility, and a producer in this case is anybody introducing any product to the market, that producer is mandated to actually ensure that the used battery is collected. So it's your responsibility. In fact, the way it's being reported now, I wish National Environmental Management Authorities there, they're expected to report, on the amount of lead acid battery that comes into the country, and those that were retrieved in terms of recycle. So what we're suggesting is that a space that is nearby, fuel station, if you look at network of fuel station, they're almost everywhere in the country, in most African countries. So it's very easy, a mechanic to say, okay, after retrieving that lead acid battery, you are actually responsible to take it to the fuel station. Then lastly, if you compare to developed country, what's actually obtainable in developed countries that every car battery, it is linked to a vehicle, it is linked to a vehicle registration number, and is linked to a driver's license. So there's a database of every, new battery being bought and being replaced in a country, in developed country. We don't have that yet in developing country. But what we're trying to say is that, this might be an idea, might even pilot it, in a county and see that every person buying battery or selling battery will follow up and ensure that the used battery is deposited in a place, and the safe place that we're thinking of is that maybe a fuel station or a car wash that have extra space that can keep this. So the mechanic will still go ahead and do his job, but by the time the person is driving out, he will just drop it at the nearby fuel station or a space where it can happen.
I believe that answers your question.
Yeah. Hello.
Hello.
Yeah, my hand had been up since.
Oh, sorry.
Yeah.
Yes.
My name is Joyce Jete. I work with Ghana Broadcasting Corporation. My question is to the representative of the Environmental Protection Authority.
Okay.
After the Pure Earth study, it came out that after that, the EPA, I'm informed, went back to do a PM2.5 data collection. With the areas that the Pure Earth did the survey at, what was the level of the PM2.5? The particulate matter 2.5. What was recorded over there?
Okay, Mr. Ejepon.
Thank you very much. I think we have done a lot of research, and I don't know which one you are referring to. Are you referring to the mercury impact assessment that was done recently?
Not that one. I'm talking about the lead ones that you've done after the Pure Earth study.
Well, I think Dr. Esmond, I wasn't part of that. So maybe Dr. Esmond, if he has about the figure.
Yeah, so
in terms of what was recorded. Is it the one that they did with Letitia?
Yeah. Yes. I believe that project was done with, of course, the Cleaner Production Department, Ghana Health Service, and UNICEF. And were astronomically very high levels of lead concentration in the soil in the Greater Accra area, Fienya and Pong. And that was also backed up with the higher levels of lead in the blood of children under 5. So which one are you referring to? Are you referring to EPA going back to conduct another study? I don't know if you can clarify.
Yeah. My question is, after your study, I'm informed that EPA went back to really monitor the air quality at that place. So the question is, what was the level of the PM2.5 that they recorded over there?
Okay.
Well,
so
I can't speak for, you understand now, I can't speak for EPA, to be honest.
That's why I directed the question to the EPA.
It was actually directed to me.
Oh.
But I'll follow up with that for you. But then we have been presenting the index, I think every week on the PM 2.5. So I don't know whether you have been receiving that on our social media, but then we publish it almost everything. But specifically to the site you are referring to, I might need to check up with environmental quality, and then probably you work with which
Ghana Broadcasting Corporation, GBC.
All right. So, in fact, I'll follow up. I don't know if you can take my contact
I
later,
will.
my Sika, and then follow up with me. Probably by tomorrow, I should be able. So you are referring to the Afienya one?
Yeah, the Afienya, either the Afienya or the Kun one, any of them.
Because I know the Afienya was actually, it was a joint research that was done by Pure Earth and EPA.
Okay.
And I don't know who actually mentioned that we are going to do a follow-up to validate the data. But then I will find out. I'll find out from environmental quality if anything of such, is conducted. And then I'll get back to you on the figures that they got from the site. Thank you very much for showing interest.
And thank you too.
Any other questions? Thank you so much. We have had a very engaging conversation. And for me, a lot of things have come up. And I think that this kinds of engagement shouldn't be a one-off thing. We should continuously do this and not only educate a few people who can join us online, but I think we should also have a way to go down there and create awareness. So as we conclude today's session, I will say that yes, the presenters or the speakers have done a yeoman's job to tell us how lead occurs, its character in the different F systems, the way it moves, how we interact with lead, and they have told us the effects that it has on us and have suggested various ways by which we should tackle the prevalence, knowing that it is a heavy metal, it's there, and it is our activities that accumulate it and cause all the harms that it causes. So fundamentally, the issue is one of justice and human rights one. It requires strong policies, as mentioned, scientific research, community engagement, and global collaboration. And even before we go global, it is something, I don't know, yes, Pure Earth is doing so well with EPA, but how are we bringing that knowledge to our students? The students are with the universities. Can we collaborate with the universities and even teach the students how to map these things? Dr. Sapa suggested that we should do a thorough or detailed geochemical mapping of Ghana. And also Mr. Ejapon also asked that data, which institution should be mandated to keep this data and readily available for our use? It's a conversation that I think that we should all have so that we can protect our children and the vulnerable in society from this preventable harm. So on behalf of the organizers, if Nana Sika, EJ, and the others, if you have any comments, you don't, or if you still do, I can still use the opportunity before I close up to thank all of you, the speakers, to thank also our active participants, and for making this session an engaging and impactful one. Let us continue to work together towards a lead-free and healthier future for all of us. Thank you so much for making time to have this all-important conversation. Nana Sika EJ.
All right. Thank you very much, Dr. Lu. I really appreciate your time and opportunity to moderate this educative section for us. As you said, it doesn't end here. Let's all come together and collaborate to, as you might know, we will upload this webinar on our YouTube page, on Pure Earth YouTube page. So you can go there if you miss anything, or anytime you want to learn about this impactful webinar, you can also visit the YouTube page and rewatch again to educate yourself. We are going to also share with all the speakers and the audience that join to also have the link for any future reference. Thank you very much. We appreciate your time. And at this juncture, we say goodbye. If Lauricia don't have anything to say, goodbye to you all. Thank you.
Thank you, Shannon.
Bye.
Bye. Bye.